Okay, well, hello everyone. Welcome to the Healthy Joints Healthy Lifestyle Show. And today we are going to talk about how to avoid gout attacks while enjoying Thanksgiving. So we have a phenomenal guest on the show today, Dr. Julia Buchfuhrer, and she's actually been on the show in the past. So welcome back, Dr. Buchfuhrer.
Thank you for having me. It's always a pleasure to be here, Dr.
It
Dada.
it is it's wonderful to have you. So Dr. Buchfuhrer is a founder of JB Arthritis and Rheumatology Center in Los Angeles, and she's been there over 7 years with over 7 years experience in the field. So Dr. Buchfuhrer finished her rheumatology fellowship at University of Arizona and completed her rheumatology fellowship, I believe, was that UC Irvine?
I did my residency at UC
UC
Irvine and a
Irvine, yeah.
fellowship at U of A. That's correct.
You're very yes. Okay. So perfect. So she has her own YouTube channel too. So when we're done, we're gonna have you go check it out with Rheum Answers. And I just love to collaborate with Dr. Buchfuhrer. So today, for those who don't know me, my name is Dr. Aminola Dada, and I help people with joint pain become pain-free and people with autoimmune diseases get their immune system back on track. So we're gonna dive into it. So it is how to avoid gout attacks while enjoying Thanksgiving. So, Dr. Brookfura, anything else that you wanted to add about yourself before we dive in?
No, I think you got the important parts as always. So, I'm so excited to be here, be talking about gout, and this is the perfect time to talk about Thanksgiving and gout.
Perfect. Okay, so I think we had a few questions sent from our God Gout group. And so one of them was, what is the most common food triggers that can increase the risk of gout flare during Thanksgiving? And how do they adjust their holiday meals to minimize it? So what
Yeah,
are the common gout triggers, you think?
this is a fantastic question, because when we go into Thanksgiving dinner and we have gout, we need to have a plan, right? You and me, we're always talking the three big gout triggers in general: alcohol, red meat, shellfish, right? But let's talk Thanksgiving. Thanksgiving's a little different. And of course, alcohol is still king here, right? We can never avoid it. So when we're thinking about alcohol, we want to think about beer being the worst, spirits being the least worst. I'm not going to say good, right? But the rest of the triggers for a typical Thanksgiving meal are going to be alcohol again, turkey, and desserts. We love our desserts here, right? And those are typically high in fructose and can cause a flare up. Um, but what's Thanksgiving without turkey? I can't tell a patient, don't eat any turkey. So, dark meat being the worst, white meat being less bad. And so it's all about portion control here, Dr. Dada, is just get a little bit, put it on your plate, enjoy that savory bit of turkey, but you don't need to load it up, right? If we're talking alcohol, we're thinking one drink and try to go for a spirit mixed with some sort of soda water, which we'll talk about later. And then if we're
Good
talking
idea.
desserts, that's where it gets a little bit more tricky. And last time I saw you, Dr. Dada, you were wearing a cherry dress with cherries all over it. And so, of course, we know cherries can minimize the risk of gout. So I would say go for a dessert with cherries or something with vitamin C, like oranges, something like that, something a little healthier as far as gout goes.
Maybe sounds like maybe a platter. So maybe a fruit platter on the side, which is still beautiful and colorful. And that way you don't feel so deprived when people are eating some other colorful desserts. So thank you. That's
Exactly.
actually a very good idea. Nice little beautiful platter. So you feel like, okay, you're also getting some nice, colorful, healthy, but still sweet stuff, right?
Right.
Okay.
We need our sweets at the end of the day.
We definitely do. Okay, so next question that was submitted was hydration, which is how important is hydration in preventing gout attacks, especially during festive gatherings where there's so much alcohol?
These good questions keep coming because hydration is king. And I just said alcohol is king, but alcohol is king for gout flare. Hydration is king for preventing gout flare, right?
Yes.
So if we're talking about having a drink of alcohol, I would say add it with soda water. Have your little shot of vodka, whiskey, whatever it is, with some soda water, and then maybe add a little spritzer of orange, some orange spritzer in there just for that vitamin C. And now you have a drink that's a lot less likely to cause a gout flare-up. Now, on top of that, we want to be very well hydrated. The gout guidelines say we want about 2 to 3 liters of water a day. So, what could that look like if you're going to Thanksgiving? We have a liter of water at home before we go to our Thanksgiving party or before we host it. And then when we're at the party, we try to get a bunch of glasses of water throughout the evening, right? Or the afternoon. And then when we get home, another liter. So that's our 3 liters spaced throughout the day. And why does this matter? Is one, dehydration is a trigger for a gout flare-up. We do not want to
Yeah.
put our body in a dehydrated state, especially when we're drinking alcohol, which
Yes.
causes us to be dehydrated, right?
Yeah.
But the other part of this is the more we drink, the more those kidneys are going to work to get that water out. And guess what's going to get out of our body with it? All those purines and uric acid that we've been eating.
There is a lot to unpack in what you just said, Doc. So let's even start with just the basic. You'll be surprised. How many glasses makes a liter?
Oh man, Dr. Dada, you're
Mhm.
stumping me here.
Um,
I think it's,
I think it's, go ahead. What do you think?
I was gonna say, I think it's got to be about four.
Okay. And
Uh-oh.
so, yeah, you know what? We can easily, I think my general rule of thumb is glasses of water is about 11, 10 to 11 per day
Yeah,
of,
so I just looked it up and it's
yeah, what
it's
is it?
4 glasses of water to a liter. So
To a liter. Okay,
my
good.
guess
So
was
fine.
correct, right?
Yeah, okay.
So
So it does. Yeah, you're right. So you said four before you go, two at the party, and four at the end of the day, which ends up being about 10, 11-ish kind of thing.
yeah.
Okay. So yeah, we're all on the same page. I just wanted to make sure that we broke it down because I also had forgotten how many glasses were in a liter. So okay, perfect. Okay, so we got the water part down, the hydration part, and then you mentioned something very important, which we know, but I don't know if everybody knows this. So just because you're drinking a liquid does not mean you're hydrating.
Yeah.
And so just because you're drinking alcohol, it actually alcohol makes you more dehydrated because you pee it out more and you pee it out with water. So sometimes people get a little confused. Well, I'm hydrating, right? I'm drinking alcohol. Thoughts on this?
Right, right. So, I like to tell patients it's the same thing like drinking caffeine, a cup of
Yes,
coffee, right?
yes,
It's going to make you urinate the rest of the day. It's going to suck
yes,
out all of the liquids in your body and get them out of your body. And that's not what we're looking for. When I talk about, getting those kidneys flowing with liquids to get uric acid out of the body, I'm talking about adding liquid into our body in the form of
yes.
water. So, yes, not all liquid is hydrating, alcohol is dehydrating. And certainly drinks in high fructose would also be prone to causing us to have a gout flare up for those same reasons, as well as being high in purines. So if we're thinking about, a very nice smoothie or a very nice high fructose juice, sounds nice, but may not be as good as that fruit platter we discussed, right?
Yeah, yeah. And I love the fact that you're a very practical physician, right? Some people would say absolutely no alcohol, but what that does, it doesn't give people options. Right? We're saying cut down on alcohol. And if you must, you actually had a little recipe, a little spritzer, a little your vodka and your soda water, right?
Yeah.
And yeah, so I thought that's actually really smart and really helpful to people. Coming up with, okay, we know what our ideal is, but we're also human and we also want you to be set up for success, right?
It's exactly right. If you
Yeah.
show up to Thanksgiving and people are used to seeing you drink and you have no drink in
Yeah.
your hand, there's going to be
Yeah.
questions and that might lead to 3, 4, 5 drinks and
Of
you didn't
course, yeah.
expect to have that
You didn't
happen.
you
So,
don't have a plan for yourself, right? So that
exactly.
that is that is so helpful and thoughtful. Thank you for that. Okay. Now, next question from the people is what practical tips do you have for people who want to just enjoy a traditional Thanksgiving dish, but need to limit their intake of purine-rich food? So you kind of brushed on that a little bit. Anything else you have? Any tricks,
Yeah,
thoughts?
I have so many tricks up my sleeve, Dr. Dada. I could write a book on this stuff and I'm sure you as well.
I'm
But I would say the biggest thing is we're trying to avoid those purine-rich foods, right? We talked about alcohol, we talked about turkey, we talked about desserts. So what can we add to our plate? We want things we can add. So veggies, there's always veggies at these places. If you're going and it's a potluck, maybe you're the one making a nice big veggie dish that you enjoy.
Yes. Yes.
Potatoes, right? We think of potatoes as, oh, high starch, not good for our weight, right? Not good for our figure. On Thanksgiving, again, calories don't count, as you know. So potatoes are very okay for a patient with gout, as far as not trying to have a gout flare up. And then, of course, low dairy items. So if we're talking low fat or non-fat milk, those can help prevent gout attacks. And those are very hydrating, as we discussed before.
Mm,
Um, so, another question I get asked all the time is stuffing. I love stuffing. Can I eat stuffing, right? Now, keep
mm.
in mind that stuffing is inside of the turkey, getting all the turkey fat and juices. That's why it tastes amazing, but it's getting those purines with it. So if we could do one of two things, right? We could have a little portion of stuffing, or what my mom used to do. My brother was vegetarian, and so my mom used to make a little vegetarian stuffing. So maybe if
That's a
I
great
love
idea.
stuffing, yeah, I'm the one making that vegetarian stuffing and bringing it over, and I'll probably have a couple vegetarian friends that are pretty happy I did so.
Yeah. Oh, that's fantastic. That's wonderful. And I also love your advice about the white part of the meat, right? That is,
Yes,
yeah, yeah. And that's also very, so you don't have to feel deprived, right? And
absolutely.
yeah.
That's
And
not
then,
that's never our goal, right?
no, no, no. I mean, you're taking away like the Grinch who stole Thanksgiving if we if we can't enjoy it. So these are really helpful tips they're gonna become in handy. Okay, next question that the people had was to, share strategies and tips for managing stress during
Ooh.
the holiday season, given that stress can sometimes trigger an exacerbated gout attack. This is such a good question.
It is an amazing question. And the question makes me think back to my medical school years. I was working in the ER and I asked one of the ER docs, what day of the entire year do you have the most business? And they said
Mm,
Thanksgiving because of the
mm,
high stress, right? People get heart
mhm,
attacks, people get strokes, all sorts of things happen from this
mhm,
very high stress holiday.
mm.
So this is a perfect question. We don't want patients to get gout attacks because of this stress. So, I have a solution that both will help with the stress and just gout attacks in general. And that's exercise. And I know no one likes to hear that answer, right? But I'm not talking going and running at the gym. I'm talking going on a nice walk in the morning, getting those fluids in your body flowing, get those kidneys working, get that uric acid out of the body. And it's also probably the most potent way to de-stress, honestly. And then what that looks like at the end of the day is you just had the dinner. Maybe you had a fantastic time, maybe you didn't. But a walk after dinner to walk off that food, that's actually a common thing I do myself almost every day.
Wow, I love that. I'm more of a morning person. I just like to get that out of the way and then be done with it. And for me, I feel like it kind of gives me that energy for the day and like, let's go get them. And so that's kind of my way of distressing. But you're right. I would say that, early in the morning on Thanksgiving, people are busy, but maybe putting a little bit of that and maybe the whole family goes for a little walk or the whole team goes
I
for a
love
walk
it.
kind of after dinner is a great idea, right? Yeah, and that's kind of, there's still more socializing, but you're not just separating like everybody, hey, after dinner, we're gonna go for a walk, we'll come back, have dessert or something, right?
I love
Yeah,
it.
so
I love
that
it.
probably
That's
makes sure we
great.
don't overstuff ourselves because if you have to walk, then you're not you're not gonna you need more energy than just kind of moving to the couch. So that's actually, yeah. So I totally agree with you. And I think we both do that in our lives too, in terms of just exercising and helping that. And like you said, it's really not, doesn't have to be aggressive. And people always think,
Right.
oh, exercise means you have to be running marathons. No, 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 no. I don't even run anymore. I used to when I was younger, but I still exercise. I like my Stairmaster. I go for walks, go for hikes. I do some weights, and I know you do the same. But that's,
Absolutely.
yeah, that's a really good way to, and you'd be surprised how much things that come at you can deal with when you've kind of set yourself up for success.
Absolutely. I could not agree more.
I think this is the next question here. So it's for those who are currently managing gout with medications. How should they adjust their treatment plan? This is an interesting one, right?
Yeah.
Um, if at all,
So
should they adjust? Yeah, if at all, did they do anything before, during, after? What any recommendations on, I guess this person is really thinking ahead. I already got gout. I'm likely to have a flare. Should I do anything? What do you think?
yeah, I love this question because it lets me know that this person is really thinking about their gout and really wants to know how they can optimize everything perfectly so that they're not having a gout flare up this holiday season. First and foremost, I will always say ask your rheumatologist. No one knows exactly what's going on with you except you and your rheumatologist, right?
Yes.
But just as general tips that I'd say and how if I were a patient, how I might think of this is first of all, there's two types of treatment for gout. There's our get the uric acid out of the body treatment, our long-term treatment, and there's our
Yes.
control of flare-up treatment, our acute treatment, as we call it in the medical world. So the long-term treatment, that stays the same. We never touch that unless our rheumatologist is increasing or decreasing based on lab values or whatever.
Mm.
So let's not even talk about those drugs, which typically is going to be allopurinol, febuxostat, something like that. Let's
Yes.
talk about the acute treatment, right, Dr. Dada?
Yes.
So if I'm a gout patient and I'm not controlled, meaning I'm still having periodic flare-ups, maybe I would want to have an extra colchicine that morning or whatever anti-inflammatory drug I'm on, whether that's ibuprofen, naproxen, a little bit of steroid. But of course, I'm going to ask my rheumatologist beforehand, do you think this is right? Because I may be at a
Yes.
maximal dose already. It may be dangerous for me to go up. But that's kind of something I'm thinking about is maybe I add a little anti-inflammatory the morning of to kind of
Yeah.
calm things down.
Yeah, I think that's actually very reasonable. And I love the fact that we're adding in, that's a great question for your rheumatologist because there's a slew of options and we wouldn't really be able to tell you kind of what's perfect for you. Like people whose kidneys are not working that well, maybe they're not the best anti-inflammatory candidates. But maybe you're not taking enough colchicine. Maybe your doctor may want to adjust that. Or some doctors, like I sometimes give my patient a stash of prednisone to keep in their back pocket and say, hey, when this attack happens, the earlier you put it out, that's my analogy. The earlier you put out that fire, then the less medication you need, right? So if you start to feel a twinge, talk to your doctor and say, hey, at the beginning of the attack, based on my history, what do you recommend? So I totally agree with Dr. Buchfuhrer and saying, hey, talk to your rheumatologist, but those are kind of the three most helpful ways, right? To deal with an attack, either preventing it or dealing with it right at the onset, right? Before it becomes this big monster that messes up the whole weekend.
Absolutely. And you and me are the same. I'm always giving my patients, I say, put this in your cabinet, use
Yes.
it on a rainy day when you need it, and use it
Yeah.
right away. Don't
Yeah,
wait.
easy. Yes, yes, so totally right. Wow, I think we could go on and on, right? I'm gonna have
Absolutely.
to, you have so many like unique ideas that we're just gonna have to have you back, right? I love the way you think things just outside the box and just, have this, this unique way of just making sure that our patients get the help that they need. And it doesn't have to be perfection, right? It's progress. It's progress over perfection. So Dr. Buchfuhrer, how do people find you to work with
Ooh,
you?
how do people find me? Great.
Yes.
So I have my website, www.jbarthritis.com. That has all of our contact info. It's available for anyone who wants it. It even has a little contact form in there if you want to drop us a message. We have our YouTube channel, Rheum Answers, as you mentioned.
Yeah.
So we're pretty available.
Fantastic. So if you are in the LA area, you know who to come find, right? If you have gout, Dr. Buchfuhrer is phenomenal. If you're in the Greater Seattle area, come find Dr. Dada. So if you think this video has been helpful, especially over the Thanksgiving period, right? Send it to your friends who have gout. A lot of gout actually runs in families. Send it to your family members. Just say, hey, these are these two rheumatologists. They're talking about what you can do to prevent attacks. So we're actually going to send it to our patients. Dr. Buchfuhrer is going to send it to her patients, right? Because we want to make sure that everybody has the tools they need to win. So if this video has been helpful, share it, like it, tell your friends about it. Thank you so much for listening, everybody. Have a wonderful day.